Are you familiar with those situations when your joints suddenly start to hurt for no apparent reason? You walk up the stairs and your knee starts to ache. You spend a long time reading or doing crafts and your arm and neck begin to hurt. The weather changes and your hip starts to ache. Usually, all these are symptoms that your joints are gradually wearing out. Why does this happen and what can you do about it? That's what we're going to talk about today. Good afternoon, this is Sergey Dlin with you. Be sure to watch this video until the end to understand. How can you slow down the aging and deterioration of your joints, which cause severe pain and interfere with normal life? As you know, many factors affect the condition of our joints. Age, excessive physical activity, poor nutrition, genetics, and also a sedentary lifestyle. All of this can have a negative impact on your joints. Over time, these factors lead to the deterioration of cartilage tissue, reduced joint mobility, and the development of musculoskeletal diseases such as osteoarthritis, for example. This is a serious disease that, if left untreated, can even lead to surgery. I've already talked about many of these factors in my videos on the channel, but today I want to dig even deeper and tell you about one very important reason that greatly affects the condition of your joints. But first, let's do a little test together. I'm going to list the main symptoms now, and you count them on your fingers. So, first, joint pain, hair loss, brittle nails, muscle weakness, digestive problems, and very slow wound healing. So, how many of these did you count for yourself? Write your answers in the comments. These symptoms may indicate a collagen deficiency in your body. So, what exactly is collagen? A lot of people take it, but let's dig a little deeper. Collagen is a protein that provides strength, elasticity, and firmness to our connective tissue. It supports bones, tendons, cartilage, ligaments, blood vessels, and also the skin. Imagine your body as a building, and collagen is the cement that holds all the bricks together. And as we age, the amount of collagen decreases, and the building starts to lose its strength, joints begin to ache, bones become more fragile, and muscles lose their power. But why does collagen decrease as we get older? The thing is, as the years go by, our cell renewal processes slow down, and our body simply can't produce collagen in the amounts we need. Damage also accumulates from exposure to the sun, pollution, and other environmental factors that harm the cells responsible for producing collagen. On top of that, as we age, our hormone levels decrease, and these hormones help synthesize this substance. As a result, the skin loses its firmness and elasticity, joints become less flexible, and bones and ligaments get more fragile. Studies show that taking collagen helps restore the integrity of cartilage, strengthen ligaments, and reduce pain in joint diseases. The density of collagen fibers in fibroblasts in the skin, cartilage, and ligaments increases. That's why joint condition improves, and you can maintain the health of your musculoskeletal system for a long time. That's why, when treating arthritis, coxarthrosis, osteochondrosis, and other similar musculoskeletal diseases, comprehensive therapy that includes collagen is important. And now we have a logical question. Is it possible to get collagen from regular foods and slow down joint deterioration? If so, which foods? Let's talk about that. This element is found in seafood and seaweed. Beef and pork also contain collagen, especially in connective tissues and skin. Chicken skin and eggshells can also be sources of collagen. For example, tofu and soy milk also help with collagen production thanks to the phytonutrients they contain. And vitamin C, which is found in citrus fruits, promotes collagen synthesis. The link will be in the top corner of the screen. But as you can see, it's pretty hard to get enough collagen from regular foods. We can't exactly eat regular eggshells, can we? And chicken skin isn't exactly the healthiest option, considering the fat and cholesterol it contains. Supplements with collagen are much more effective for addressing a deficiency, since they're easier to absorb and contain additional helpful ingredients. But how do you choose the right collagen? After all, there are so many different manufacturers these days, and you want to be sure of the product's quality, right? The first thing you need to know is that there are 3 types of collagen. Types 1 and 3 are good for nails and hair, and the second is essential for joints, cartilage, and bones. It's important that the collagen is hydrolyzed. This is a form of protein that is best absorbed by the body. A good choice would be collagen in powder form, because the powdered version allows you to include the right amount of beneficial ingredients in each serving. Plus, when we drink a beverage made from powder, it immediately interacts with the walls of the intestines and is easily absorbed. With capsules and tablets, this process is more complicated. When choosing collagen, it's also important to pay attention to the dosages of the active ingredients in the supplement. Often, these amounts are tiny. Ideally, the daily dosage should be more than 3.5 grams. It's a huge plus if the product contains the following components, such as vitamin C, hyaluronic acid, and the so-called chondroprotectors chondroitin, glucosamine, and MSM. And not just for them to be present, but to be included in effective dosages. All these components help collagen to be absorbed by the body and enhance its effect. The first helps protect cartilage from destruction, reduce calcium loss, and speed up recovery. The second helps block enzymes that destroy cartilage and is necessary for the permeability of the joint capsule. And the third helps reduce inflammation in the joints and ligaments, relieve pain, and speed up recovery. It also helps improve blood circulation and aids in breaking down calcium deposits. And the fourth is hyaluronic acid, the main component of joint fluid. It helps transport nutrients and acts as a lubricant, reducing friction in the joints. Now let's talk about how and when to take collagen properly. It's best to take collagen in the morning or in the evening. For example, I take collagen in the morning on an empty stomach, half an hour before eating. If you prefer to take collagen in the morning, it will give your body the necessary building blocks to recover after sleep and energize you for the whole day. And if you choose to take it in the evening, take collagen before going to bed. At night, your body actively recovers, and collagen will help regenerate your skin, bones, and joints. It's important to take collagen regularly to see positive results. Follow the dosage recommendations on the product packaging. Usually, that's 1 or 2 servings per day. And now, here's the most interesting part. Which dish contains the highest amount of collagen? And you might be surprised, but it's the familiar and well-known aspic. It's made from meat, bones, and connective tissues, which release collagen into the broth during long cooking. As it cools, this collagen forms the jelly-like consistency that's characteristic of aspic. That's why eating aspic can be a good way to add collagen to your diet. Give this video a like if you love aspic too. I'm sure you all know the recipe for this dish, but just in case, we'll show it here on the screen. I hope you now understand how important collagen is, and that the condition of your joints depends on consuming it. Don't forget to subscribe to the channel to keep learning how to strengthen your body at home. This was Sergey Dlin with you. Stay healthy.